Hello again. Welcome to Ask Dr. Pane. Today's question is from a woman with a few children who misses the perkiness of the breasts. She now has sagging breasts and wants things restored, and the question is, does she need a lift, a reduction, an augmentation, or a combination? And to describe the photos, I kind of drew them out like this. So what we see is what they call grade 3 ptosis. So the breasts are kind of down here, pointing down at the floor, and the breast is kind of ending up here. Would be a line here where the breast would be ending. In this case, there's no concern about scarring, but she just wants to be more full. Now here, the breasts weren't very large, so the options are a full breast lift with or without an implant. And how would we decide whether we want to use an implant or not? Depends on how much tissue is there and how large the person wants to be. They don't want to be very large. Usually I recommend at least a smaller implant to get some fullness of the upper part. And there will need to be a scar around the areola and on the underside of the breast. There's very few, if any, ways with this degree of sagging to get a good result without that kind of scarring. So be careful if you hear that from someone. Now, the question comes up is if there's no implant desired. Sometimes people just don't want implants at all. In that case, I like to reposition the tissues internally, and it does make the breasts seem a little smaller because we're reducing the skin, but they're not really being made smaller, they're being lifted up. But the disadvantage of that procedure is even with the best work internally, there can be some flatness of the upper part. So that procedure is best when somebody does not want implants or the tissue is quite large actually, where we would want to reposition most of it, maybe even reduce some of it. The lift with the implant is going to aid in the upper pole fullness, and also if the person just wants to be larger, maybe the tissues are more deflated rather than descended. So if that's the case, then yes, we do want to add some volume there, as long as they're not too deflated, because then you have issues combining the procedures. So here, lift, reduction, augmentation, or both, I would say probably both, possibly lift alone depending on how thick the tissues were and whether or not the person wants to have an implant at all or wants to avoid implants completely. So that would be my take on it. One of those two options would be refined with an in-person consultation, but overall should do very well from what I saw in the pictures, and we will see you next time.